One of the issues that a lot of us are sort of scratching our heads about right now is that we've noticed a stage migration in prostate cancer diagnoses across the US. And what that means is the patients who are being diagnosed now with prostate cancer, on average, are being diagnosed at a slightly more advanced stage of cancer than they were before.
We know that PSA testing has gone down. Several medical societies actually recommend against PSA testing based on, the 2012, now, a decade-old recommendation from the U.S. Protective Services Task Force saying there's more harms to PSA than good. And, back in 2012, a lot of that was correct.
Okay, but what about people with risk factors or a longer life expectancy? Can we be smarter about screening? But instead they were just like, no, don't screen this. And then on top of it, they didn't even have recommendations for people who are Black or had a family history of prostate cancer. And they said basically like, talk to your doctor. And it's obviously difficult as a primary care physician to like sit down and have a very nuanced discussion about PSA screening and then also talk about cholesterol and hypertension and diabetes. So I think a lot of folks just took that whole recommendation. We're like, okay, we're not going to check for prostate cancer because they said don't screen for it. And so, with that, you see this sort of shift or stage migration back towards some cases being detected later because we're not checking, maybe somebody who's on the cusp, like somebody's 74, 75 years old, and you're like, you're fine, don't worry about it. Or somebody who's kind of on the younger side, but maybe had a family history and didn't relay that. And they're like, oh, you don't need to worry about that anymore. And so those patients kind of teeter along, not getting a PSA test. And then lo and behold, you find that they have a very high grade cancer when somebody checks it after they present with symptoms or something else.
Many of those negative aspects of PSA testing have been markedly improved.
We as a urologic community are trying to help raise the awareness about this and encourage men to seek screening or at least have the conversation with your primary care doctor about the risks and benefits so that you can pursue screening if you wish to do so.